Dr. Gidado. Today we have Dr. Gidado with us. Dr. Gidado is a medical doctor and a physician. He worked across TB, HIV, and leprosy and tuberculosis. He started his career in Nigeria as a clinician and then moved on to the program management and has been in the TB domain for almost 20 years. Welcome to Union Conference.
Thank you very much.
Yeah.
Thanks for having me.
Yeah, so thanks for coming down to our place. So Gidado, just one question. So the entire conference is packaged around evidence to practice. And in the recent years, we have seen that a lot of new tools coming into TB. So when we started our career, we probably was actually kind of looking at miniature X-rays and also like chasing down the patient for sputum for testing. Now we are seeing many new screening tools, many new ways of diagnosing tuberculosis. What are the challenges you think that in the uptake of these new tools?
First, I think I would just like to appreciate your point that TB program for the first time is facing a lot of opportunities at our disposal with a lot of diagnostic opportunities, a lot of treatment regimen, which we never enjoyed in the past. Therefore, I don't want to see it in the context of a burden. I want to see it in the context of opportunity, because in the past, these opportunities don't exist. But like you rightly said, creating new tools is completely different from ensuring their utilization. So
Correct.
These opportunities, up till this moment, we are facing some significant challenge with their uptake, with their optimization, and with their utilization in the field. And I think that is what we all need to collectively push forward.
So I think you have a lot of experience in running projects, introducing new tools, working with the governments and scaling it up. And KNCV as an organization also represented in STAC committees, which also influence global policies. So what is your experience on introducing new tools? As we look at the conference philosophy or the focus is again evidence to policy, practice. So that evidence generation and the practice implementation, you have as an organization, you have run many projects including Challenge TV. Now you are into different domain altogether. So how do you see that? What should be the pathway of getting new tools into a scale? What are the critical barriers which, as an expert in this field, we are facing? How do we collectively approach it? You did mention about we need to collectively approach it. How do we do it?
So I think this is a $1 million question, and I think we all collectively need to find an answer to it.
Correct.
Because most of the tools we are developing, we need to realize that we are developing them for a purpose. And the purpose in TB is ensuring early access to diagnosis and enrollment to care. And what is happening with the new tool is that we are always finishing the basic science before we think of social science. But that cannot be the case.
Yeah.
The business people don't operate that way. The business people compare both science and social science of uptake at the same time. What is happening in the science of TB is that we finish the innovation of developing the tool, then we start thinking, how do we ensure people use it? But that cannot be the case. That is one major gap that we collectively need to find a way of resolving. As we are moving towards new tools, we should also be speaking to the end users. What is the patient perspective? What is the TB program perspective? What is the frontline healthcare workers perspective? In utilizing that tool, not as an afterthought. We cannot finish the tools and then start thinking what is the implementation science of this tool. This is one area I think we need to pay attention to. But the second area we need to pay attention to is regulatory agencies. Most TB programs are not responsible for approval of new tools. It is a different entity in most of the TB high burden countries that is responsible for approval. So engagement of approval agencies early in the introduction of new tool is extremely important. And the third one is the engagement of professional association. We must ensure that professional association that will capacitate the utilization of this tool are also engaged early in the game. So my point is, science and science of practice must come a little closer. We cannot take it on a linear approach. Finish primary science, then do implementation science. No, they must overlap.
You touched upon a critical point of patient-centered design. And very recently, I recall that Stop TB Partnership organized a workshop on how do we get the patient feedback and end user feedback, as you rightly mentioned, and then factor in that into the product development. It's a wonderful point to discuss at this time. So secondly, you also mentioned about the regulatory preparedness. So WHO is now thinking about pre-qualification of digital tools, but they are also struggling because this is an evolving science, and every day this is actually evolving and maturing into a different way. The third thing you mentioned about is about the policy part of it,
Yeah,
right?
and professional association.
Professional association part of it, which is very important as the new, especially the new tools like in AI, which needs a little bit of education from both the professional side, because they are the one who actually interpret this thing and then take the final decision. Switching a little bit from the overall new tools to specifically on the X-ray and AI thing. So if I recall correctly, 2008 onwards, this technology of X-ray AI has been there in the TV domain, and it was only one player. Now you are seeing multiple players coming in, and you were also part of in Nigeria. KNCV has actually evaluated a couple of technologies, and we were also participating in that. How do you see that? What is the rationale of picking these technologies when you are actually designing a program and deploying it?
So for me, again, artificial intelligence is an opportunity.
Yeah.
Anyone who sees artificial intelligence as a liability, he's making a mistake, because he's eventually going to be forced to use it.
Yeah.
So I think being early into it and acknowledging its value into the work we do is extremely important for so many reasons. It increases efficiency. It increases uptake. It reduces error. It can just be as fast as we want, and we are looking for how to make things fast.
Yeah.
To ending TV is all about being fast,
Yeah.
and therefore artificial intelligence is extremely of value to all of us.
Yep.
Are there challenges around it? Of course, because artificial intelligence is something new that we all have to learn. Areas around ethics,
Yep.
standardization, privacy, security. But we cannot use these excuses not to uptake artificial intelligence. We should acknowledge them,
Yeah.
come up with policies around them, but we must utilize the power of artificial intelligence. If we must reach everyone to NTB, we have to utilize the power of artificial intelligence. And in making choices, wherever I find myself, I don't want to go into the competition world of the market forces.
Okay.
I don't work with the market forces. I work with what is the best for the patient. And what I realize with most of the tools that everyone is developing, they have a role to play.
Yeah.
So what we acknowledge and preach to our program managers in the field, make sure you see everything from patient perspective, and make sure that every tool is complementing to other. Don't move into a competition of this is better or this is better. No. What is the role of every of these tools in ensuring we provide access to people who need it most?
That's a fantastic point of actually, rather than looking at the driven by the market forces, look at the patient needs and accordingly design. And to be very honest, Qure keeps that philosophy at heart, and we design products from a health system perspective. Thank you so much, Dr. Gidado, to actually share time with us.
Thank
And
you
thanks
very much for
coming
having
in
me.
and
Thank you so much.
Wonderful
Good.
insights from you.
Thank you so much.